the current administration has put forward, transparency, but that's not touching any of the in between. So how do we bring that to light so that we can understand really where these costs are going?
Thank you. I think that's a really important point, and I think transparency is a huge element of this, so that we can see where the dollars are going and what it's being spent on, what's necessary versus what is being driven really just by a desire for more profits. But I think that this cost that you're referring to is directly linked to their relationship with big insurance and big pharma. So when we're talking about overhauling our healthcare system so that it is not one that, as it is today, is really being driven by corporate profits and greed, then we're going to be able to get to the heart of where these costs are coming from and the relationships and the connections that these hospitals have with big insurance companies and with big pharma, whether they're kickbacks or other things that are happening that are further driving the cost and delivery of healthcare up. We can't get to these problems if we don't actually get to an inside look and have that transparency to see where these dollars are going and exactly how they are being spent, either to serve the best interest of the patient and the quality of care, or are they just expanding or inflating the so-called administrative costs that go into the pockets of the executives. This is a little bit of a different topic, but we're seeing a lot of the same thing in higher education as well. The ever increasing rates of tuition. We're not seeing, the tuition rates are going up, therefore there are better outcomes, right? That our kids are graduating, they're able to get a job with good pay in the field of their choosing. No, we're seeing a lot of this inflation in expenses and costs at the administrative level, not linked to an increasing quality of the delivery of that education. So I think once we peel back the layers, we can get to the heart of the root cause of the problem so that we can begin to solve it and make sure that our priorities are lying in the well-being of our people, whether they be patients, those who are needing care, or our students in our education system.